My name is Rachel Pantesco, and today I'm going to be doing my presentation on cerebral palsy. Let's first start with what is it? It is a group of disorders that affects movement and muscle tone. It causes difficulty for the patient to maintain balance and posture, and it also may even have associated conditions such as intellectual disabilities, seizures, and vision or hearing loss. There are a lot of different symptoms that can be associated with cerebral palsy, and not every patient that does have cerebral palsy is going to show the same symptoms as their other patients. Symptoms such as their variations in muscle tone, such as being either too stiff or too floppy, stiff muscles and exaggerated or normal reflexes, and tremors or involuntary movements may affect how we as EMS providers secure them to our stretcher or even move them to the ambulance. Excessive drooling or problems with swallowing that they may have may affect how we secure or get them to keep a patent airway. Delays in speech development or difficulty speaking may give us a harder time providing or receiving a sample from them or getting a proper assessment. And seizures is another thing that we may come across when dealing with patients with cerebral palsy. Other symptoms include learning difficulties, delays in reaching motor skills milestones such as pushing up on arms, sitting up or crawling, difficulty with sucking or eating, and even difficulty with fine motor skills such as buttoning clothes or picking up utensils. There are a few different types of cerebral palsy. Three I have listed here are spastic, ataxic, and dyskinetic cerebral palsy. Spastic cerebral palsy, which is the most common, is from damage to the motor cortex. It's characterized by jerky movements, muscle tightness, and joint stiffness. It's a form of hypertonia or an increased muscle tone. Ataxic cerebral palsy is the least common, and it also means without order. It'll show clumsiness and instability and disorganized movements. You'll also see shaky movements and effects in balance and the sense of positioning in space. That's going to be caused from cerebellum damage. Dyskinetic cerebral palsy is from damage to the basal ganglia, which is responsible for regulating voluntary movements. So you'll see twisting and repetitive movements known as dystonia, slow stormy movements known as athetosis, and dance-like irregular unpredictable movements known as chorea. Here you'll see many involuntary movements. This slide is just a visual aid showing you where the damage in the brain is located in the specific types of cerebral palsy and then what body parts it does affect and how it affects them. Here I'm just going to list some causes and risk factors when it comes to cerebral palsy. First off is the disruption of blood and oxygen supply to the brain. So ischemic strokes that can occur during fetal development or even shortly after birth, and then birth hypoxia, which is just the baby losing oxygen before or during birth. And that is only estimated to account for less than 10% of cerebral palsy. Low birth weight and premature birth is another risk factor or cause for cerebral palsy. There was a study in Scotland that found that children born as a part of a multiple birth pregnancy, like twins or triplets, were found to be almost 5 times more likely to have CP than singular births. And that's just due to the fact that they are more likely to have low birth or weight or premature births. Other causes or risk factors for the development of CP include the infection in mothers, so infection in the placental membranes, also known as chorioamnionitis, or other signs of infection in the mother, like blood infections or fever during birth. Other factors like gene mutations leading to abnormal development or birth defects of the CNS were found to be more common in children with CP. Also, brain injuries after the baby is born from things like falls, MVCs, and infections like meningitis could cause the child to develop CP. Diagnosing CP at an early age is vital, and it takes several steps, which I'm going to list in the next few slides. The first step is developmental monitoring, which you really do in any birth after a baby is born. It tracks the child's growth and development at every doctor's appointment. They do this by asking parents if they have any concerns and watch how the kid moves, etc. If concerns are brought up here, a developmental screening should be given as soon as possible. A developmental screening would be the second step when diagnosing cerebral palsy. It's a short test that is given to see if the child has any specific developmental delays like motor or movement delays. This screening is given in the form of interviews and questionnaires given by the parents and doctors. The developmental screening is recommended at 9, 18, and 24 to 30 months. At 9 months, some issues with movement can be seen, but it is easier to catch at the 18 and 24 month mark. And lastly, developmental and medical evaluations are given to diagnose cerebral palsy. These are used to find the specific type of CP that affects a child and what muscle groups are most affected. The doctor will look at the child's motor skills, the muscle tone and reflexes, and his or her posture. They also want to rule out other disorders that can cause the similar symptoms. There are many specialists that are involved here, but a few I listed were developmental and neurodevelopmental pediatricians, child neurologists, and physiatrists, and pediatric rehab doctors. Diagnostic tests can be given as well to a patient just to see what caused their cerebral palsy. Tests like brain imaging tests, X-ray computed tomography or CT scans or MRIs, as well as an EEG, genetic testing, or metabolic testing. Okay, so the epidemiology of cerebral palsy. Cerebral palsy is the most common motor disability in childhood. Population-based studies from around the world report prevalence estimates of CP ranging from 1.5 to more than 4 per 1,000 live births of children. About 1 in 323 children has been identified with CP according to estimates from the CDC's Autism and Developmental Disabilities Monitoring Network. About 764,000 children and adults currently have cerebral palsy. About 500,000 children under the age of 18 currently have cerebral palsy, and about 10,000 babies born each year will end up developing cerebral palsy. I thought it would be important to discuss how us as EMS providers would interact and what we might find when we do interact with cerebral palsy patients. So firstly, I think we should do our best to transport the patient with all of their equipment that they use daily, just to make it easier for them to be in the hospital and on their transport home from the hospital. Some cerebral palsy patients may have chronic pain, paresis, or paralysis, and this could hide new injuries, so keep that in mind when you're doing trauma assessments and other sorts of assessments. Patients could also have difficulty or be unable to move or straighten their limbs, so we gotta be cautious when moving or securing them to our stretcher. We could probably ask caregivers for the best or safest way to do so, since they do that frequently. We also should make sure that we're padding all voids if we do use a long board, or even just putting them on the stretcher. Another issue we could find is having difficulty obtaining vital signs due to limb contractures or excessive movement. So for example, we could consider taking blood pressure manually to limit their movement interference. So, what's the prognosis of patients living with cerebral palsy? The initial damage that's caused, it will not worsen as the child gets older, but there are definitely many complications that may progress over the child's life if ignored. Some complications or disabilities that can affect the life expectancy include reduced vision or hearing, seizure disorders, feeding difficulties because of the difficulty in swallowing and drooling, growth restriction, respiratory disorders, intellectual disabilities, behavioral concerns, communication challenges, and the limited mobility of the patients. That being said, the impact on a patient's lifespan also depends on the patient's access to quality care. Life expectancy is going to vary from patient to patient, but for the most part, for women, they could even live up to between 70 and 80, and for men, between the ages of 66 and 76. But like I said, it depends on the quality of care and the severity of their diagnosis. Although treating our patients is a main priority, it's also very important that we are able to educate our patients on their disorders and what we can do and services we can point them to help them. It's important that we make sure all of our patients are educated on their treatment options as people with cerebral palsy. Treatment will vary from patient to patient because not every person with CP presents the same, but on the right there's a picture that shows all the different availability of treatments. Physical therapy can be used to strengthen muscles to prevent weakening or deterioration, or even loosen muscles to prevent joint contracture. Occupational therapy could be used to improve fine motor functions and enhance functional abilities and make it easier for them to do daily activities. Speech and language therapies could be used to improve oral muscle function and teach alternative communication methods like sign language or etc. We should also educate the patient on assistive technologies that could help them get around easier and make their daily living easier, such as walkers, crutches, wheelchairs, and other things. There are a few medications that we could educate our patient on that'll help. One is baclofen, and that loosens spastic muscles throughout the body. And there's another one, and it induces muscle paralysis in isolated muscle groups to help the spasticity in some of the muscles. Lastly, there's always the option of surgery. This will help relax taut muscles. It'll help lengthen tendons and replace tight tendons with looser ones. It will also sever nerves that control taut muscles. There are many services available for patients with cerebral palsy, one of which that I found when doing research was the Individuals with Disabilities Education Act, also known as IDEA. They have both early intervention, which is between the birth and 36 months or 3 years, and school age interventions, which will leave them available for 3 to 21 years of age. The early interventions, or Part C of IDEA, might include family training, counseling, and home visits. So they will provide occupational, physical, or speech therapy, hearing loss services, health, nutrition, social work, and assistance with service coordination. Also will provide assistive technology, devices and services, and transportation. Through the IDEA program, they will also be provided these services throughout their school age. So like I said, 3 to 21 years old, and that is provided free of charge through all the public school systems. Here I provided a list of other places you could find cerebral palsy support. This is just a small list that I found. There's many, many more, but I think that this is a good list to have if you do come across a patient with cerebral palsy who doesn't seem like they have the support they need. A few of which are called the March of Dimes, Cerebral Palsy Foundation, the ARC, United Cerebral Palsy, and there's many more. And that is my project on cerebral palsy. I appreciate you taking the time to listen. Thank you. Bye-bye.